You know, throughout the 20th century, there were more than 500,000 cases of measles reported each year in the United States. Then in 1963, the same American doctor who won the Nobel Prize for his work with the polio vaccine developed a vaccine for measles, which has been responsible for saving tens of millions of lives. In fact, less than 40 years later, in the year 2000, measles was considered eradicated in the U.S. It was also around that time a study tried to link the measles, mumps, rubella vaccine to causing autism. However, it was riddled with scientific errors, the study, yet it took until 2010 to strip that study from the scientific record, which still left plenty of time for that disproven theory to spread like a virus through the anti-vax community, which is why we've seen waves of measles outbreaks since then. More than 200 cases in 2011, 667 in 2014, capped by the Disneyland outbreak, nearly 400 in 2018, followed by more than 1,200 in 2019, the highest total in nearly 4 decades. That outbreak covered 31 states, including Idaho, for the first time in nearly 20 years. Well, here we are in 2025, only 8 months into the year, and we've already surpassed that number nationally. And this week, Idaho confirmed its 3rd case of the year. Not nearly as many as we saw in 2023, but as Aspen Shumpert learned, the uptick could mean other cases are still out there.
We are worried that measles might be here to stay.
Wednesday, the Idaho Department of Health and Welfare confirmed the state's 3rd case of measles this year. All of them within this month.
Going from 0 to anything is of concern, right? We've gotten used to this world where we don't have to think about measles. So we are very concerned to see these 3 cases, especially since they don't appear to be related to each other. We think this is a sign that there are more cases to come.
Dr. Christine Hahn, an epidemiologist at the Department of Health and Welfare, says before this, Idaho hasn't had a case of measles since 2023.
And even that was an unusual event. We really have not seen a lot of measles in the last years in Idaho.
Dr. Hahn says the 3 cases this month were all children, and from their investigations, it appears all 3 were also unvaccinated for measles. The first case was confirmed earlier this month in eastern Idaho, the second in Kootenai County last week, and a third in Bonner County Wednesday. On top of those confirmed cases, the measles virus was detected in Coeur d'Alene wastewater on July 29th.
Which suggests there are people infected in the community. So we know that measles is circulating. I would especially urge folks in northern Idaho to pay attention to this. There are communities in northern Idaho that have very low rates, and to really consider the vaccination, yes.
Dr. Hahn says they have seen a decrease in vaccinations for measles across the state post-pandemic.
We think the pandemic, some people just missed their shots during the pandemic because people were just hunkering down in place and not getting in for their routine appointments. Some of those kids never got caught back up. But also I think there's just a growing vaccine skepticism and hesitancy, mistrust of the information that people are getting. We understand that people made decisions and at the time based on the fact, well, gee, there's no measles, why would I vaccinate? Well, measles is back. So we do hope that people take the time to reconsider.
But Dr. Hahn says measles remains one of the most contagious viruses we know of.
It can be very serious from the standpoint of it can cause pneumonia, it can cause a brain infection, it can cause severe high fevers leading to seizures, and very, very severe outcomes, landing the kid in the hospital, and potentially, very rarely, the child could die from the measles.
And the 3 cases this month signal a pivotal moment.
We seem to be shifting now in the United States where we're starting to see it circulate more, and we just want the public to think about how they've been thinking about measles and rethink it. Now it seems to be much more present. The risk seems to have changed.
These 3 cases, Dr. Hahn says, were before school started for these 3 kids, but it is back to school season now. With that, there is a higher risk to contract the disease.
And I think with all these outbreaks that we've seen since the year 2000, 90% of those that had come down with these cases were unvaccinated.
Yep.
And again, spread out through the entire country. But that spike of 10 in 2023, I mean, we don't know. We could get that again this year.
Yeah.
It's possible.
And like Dr. Hahn said, these 3 kids were unvaccinated, so urging people to kind of reconsider the vaccine at this point.
All right, we'll see what happens. Thanks, Aspen.